Okay, fantastic. So good evening, everybody. Welcome to today's health seminar. As usual, being a Sunday, we normally meet and we discuss matters health, how we can live a longer, healthier life. And like I said earlier, November is a diabetes awareness month. And that's why we decided to just go with this particular program. I know we've done it before, but I know it will help somebody out there who probably isn't aware of the information that you're going to share right now. My name is Fred Gichuki. I've been in the wellness industry for more than 20 years. I joined this industry in the search, seeking to make some money. And I got to learn matters health. I got very excited about health. And I started giving people interventions and solutions to some of the health challenges that they were facing. And I used my parents as guinea pigs. In fact, my mom was suffering from high blood pressure. My dad had ulcers. I used the products of Neolife and I was able to sort them out. Today, my mom is 83 years of age, going 84. My dad is 85 years of age, and they both don't have the challenges they used to have. My mom's pressure has been stable for the longest. My dad's ulcers disappeared. In fact, his most favorite drink is fermented milk. So that tells you that these products work. So I want to get into it and just share a little bit about diabetes so that you can see how can we avoid becoming diabetic. And if you're already a diabetic, how can you manage it and how can you reverse it? So that's what you're going to be discussing today. And so let's just move there and get to see what diabetes is all about. Okay. Seem to be having a bit of a problem with my screen. Okay, there we are. So what is diabetes? Now, diabetes is a chronic disease that occurs when the pancreas does not produce enough insulin or when the body cannot effectively use the insulin it produces. Now, insulin is a hormone that regulates blood sugar. When we talk about hyperglycemia, that means you're talking about raised blood sugar. And this happens in uncontrolled diabetes over time and may lead to serious damage to many of the body's systems, especially the nerves and blood vessels. Now there you can see what happens. You eat some food with carbohydrates. We're talking about grains, fruit, milk, and sweets. And the carbohydrates are quickly changed to sugar, glucose after digestion. And the glucose enters the blood to go to all parts of the body to produce energy. And then your pancreas detects the rise in blood sugar. So it makes insulin and releases it. Now the insulin helps the sugar to get into the cells in your body so they can use the sugar as energy. Now that's the normal, that's a normal way that it's supposed to happen. But in the case of diabetes, the system doesn't flow that smoothly. And you're going to look at it and see why. Now, let's look at the types of diabetes that we have. Number one, we have type 1 diabetes, which can be called juvenile or childhood onset diabetes. Now, this one is characterized by deficient insulin production and requires daily administration of insulin. Now, symptoms include excessive secretion of urine, thirst, constant hunger, weight loss, vision changes, fatigue, and these symptoms may occur suddenly. So that's the first type of diabetes. Then you have type 2 diabetes. This is non-insulin dependent or adult onset diabetes. Now, it results from the body's ineffective use of insulin. The majority of people with diabetes have type 2 diabetes. This is a common one. This type of diabetes is largely the result of excess body weight and physical inactivity. So it's a diabetes that will come to you because of your lifestyle decisions. Now, symptoms may be similar to those of type 1 diabetes, but are often less marked. As a result, the disease may be diagnosed several years after onset and after complications have already arisen. And that is why we say that constant checkups to check your blood sugar are extremely important. Until recently, this type of diabetes was seen only in adults, but now it is now occurring with increasing frequency in children. Okay, so there you have a diagram that kind of explains what happened. The stomach turns food into glucose. Glucose enters the bloodstream, just like we had said earlier. The pancreas creates insulin, which enters the bloodstream. And the cells of the body cannot take the glucose in, thus causing a buildup of glucose in the bloodstream. And that is what we say somebody has gotten type 2 diabetes. Yeah. Moving on there. Then we have gestational diabetes. Gestational diabetes is hyperglycemia with blood glucose. These are values which are above normal, but below those of diagnostic diabetes. Gestational diabetes occurs during pregnancy. Women with gestational diabetes are at increased risk of complications during pregnancy and at delivery. The women and possibly their children are at an increased risk of type 2 diabetes in the future. Gestational diabetes is diagnosed through prenatal screening rather than through reported symptoms. So you can see there when a pregnant woman has gestational diabetes, the pancreas produces more insulin to cope with the high level of blood sugar, glucose. The insulin does not cross the placenta, but the glucose does, giving the baby high blood sugar, high glucose levels. The extra energy from the glucose becomes fat, sometimes resulting in a big baby. So the baby can be born being quite huge. The baby's pancreas will produce insulin to counter this. Excess insulin raises the baby's risk of being obese or having diabetes in the future. So that's gestational diabetes. Let's move on there. Now, it's important to mention a little bit about COVID-19 and diabetes because COVID-19 came in and it brought quite a few complications where diabetes is concerned. And some people, it led to what we call a newly discovered diabetes. Some patients who did not have diabetes prior to the infection of COVID-19 developed new onset diabetes after recovering from COVID-19. And COVID-19 has been known for wreaking havoc to your lungs and causing acute respiratory distress, but it also worked in affecting people who had diabetes. Maybe they didn't know about it, but it just aggravated it so much. Now, this talks about, a little bit about how COVID-19 came about. Many people are experiencing only minor symptoms, but others it developed into a life-threatening disease. Now, it also became very clear that diabetes and obesity are common risk factors for people who got severe COVID-19. Now, it has been found that beta cells in the pancreas are highly permissive to COVID-19 infection. The pancreas, which lies behind the stomach, is a complex organ composed of numerous types of cells which assist in digestion. It also contains beta cells that make insulin, a hormone that escorts sugar molecule from the blood into the body cells and is used to produce energy. When the COVID-19 virus attacks the pancreatic beta cells, if insulin production decreases. And this is where COVID was known to trigger the onset of diabetes. Now, it's important to know this and to understand this because the COVID-19 disease is not over. It is still present very much so amongst us, and it can easily attack any one of us. And when you have this kind of information, so if you get a sudden onset of diabetes from nowhere, which has been followed maybe by a cold and a flu and that kind of thing, it could be that you actually got COVID-19 and it aggravated that particular problem. Now, diabetes is on the rise, which this is very, very sad news. 422 million adults have diabetes. Yeah. Now, that is 1 person in 11 people has diabetes. Now, again, this is just a recap. Type 1 diabetes, the body does not produce enough insulin. Type 2 diabetes, the body produces insulin but can't use it well. Gestational diabetes, a temporary condition in pregnancy. Now, consequences of diabetes, before that, you can see 1.5 million deaths caused by diabetes worldwide. That's a lot of people dying because of diabetes. It is indeed a serious disease that we need to really take care of and be conscious about and do our best to avoid being victims. Diabetes can lead to complications in many parts of the body and increase the risk of dying prematurely. So in your brain, diabetes can cause a stroke. It can cause blindness. It can cause a heart attack. It can lead to kidney failure. It can lead to amputation of your legs and your limbs. And that can be quite a challenge when it actually becomes very serious. So these are some of the consequences of diabetes, just to remind you of what can happen. And that's a pictorial presentation of the same. Eye disease, that's one of the things. You can get diabetic retinopathy, glaucoma, cataracts, renal failure, or diabetic neuropathy, diabetic foot, stroke, heart damage, nerve disease, peripheral neuropathy, and arteriosclerosis, which are weakened nerves right there. And you can also develop what you call insulin resistance. And this can actually come about in a situation whereby find that you're always tired, you're always hungry, and you're wondering what is the problem. Probably you could be having some insulin resistance. Now let's look at solutions. Let's look at solutions so that you don't get too gloomy and feel like this thing is not solvable. It is solvable. There is a solution to diabetes. And how can you fight back against diabetes? How can you ensure that you don't get diabetes? And if you have it, how can you be able to manage it? For us to get into that, it's good to look at matters health and what should your lifestyle be like. Number one, you should exercise often, 30 minutes a day, very important. Get your heart racing. So long as your heart races 30 minutes a day, it fixes everything else in your body. Then you should rest enough hours. We are talking about 6 to 8 hours a day you should spend asleep. This enables your body to rest. It enables the body to produce hormones, which relax the body, and you reboot. It's like rebooting the computer, and you get more energy. Now, if you don't rest enough, you start getting tired, you get stressed out, and this provides a very good environment for one to become diabetic, because the body is very tired, your immunity is low, and the body is not functioning at peak levels. Then your diet, you should really take care of your diet. And I'm going to spend a little bit time on matters diet. so that you can be just be able to see how can you be able to work with your diet, because your diet can either make you or break you. Yeah, you can either feed the person that is messing up your life in your body by eating junk food, or you can feed the part of you that actually fixes most problems by eating fresh food that is not junk food. So we are going to talk about that just now. Now, something interesting here is about your BMI. It's important. It is important to be aware and cognizant of your BMI, so that you can be able to keep your BMI at healthy levels. For example, for those who are not familiar with the BMI, is where you calculate your weight versus your height. And you can actually step on a weighing scale somewhere in town, and they can be able to calculate your BMI for you. And they will be able to show you. And on this graph, you can see if you are between 18.5 and 24.9, you have a normal weight, which is a healthy weight. If you're below 18.5, you're actually underweight, which is also very dangerous. You need to build up your muscle and your body weight to go to the correct position. But if you go to 25 to 29.9, then you're overweight. That means that you have too much body fat that can bring problems to you if not checked. Now, if you go to 30 and 39 to 39, that's obesity. You're already obese. And then if you're over 40 on your BMI, then you have morbid obesity. So it's important to know about your BMI. And when you go to a health practitioner, ask, what is my BMI? And they'll calculate it for you. They have gadgets that do that for you. And immediately they will measure your height and they can give you a figure. Then you can see where you fall, so that you know, do you have too much weight? Because if you're overweight, then you run a risk of getting diabetes, amongst many other lifestyle diseases like osteoarthritis, high blood pressure, and many others. So it's important to ensure that your BMI is in the healthy range right there. Now, let's look at our diet. How should we be eating? Now, we should be eating like the pyramid that is actually on my right, which might be on your left, where you find that you have a lot of whole grain. Your plate should have 40% whole grain, 30% fruits and vegetables, different colored fruits and vegetables, not the same color, different colored fruits and vegetables, fresh fruits and vegetables, uncooked. That's the right word. Then a minimal amount of proteins, especially red meat. In fact, we say that a quarter kilo should be eaten by 12 men. That tells you that you really don't need red meat. Then eat more of white meat, that is kienyeji chicken, and fish, that is recommended. Now, pig is in the avoid list. It's part of the red meat that we're talking about. Then take a minimal amount of processed foods and sugar in your diet. In fact, they say you need to take a teaspoon of sugar a day, a teaspoon of fat in a day is good enough. That's how you're supposed to eat if you are to live a healthy life and it be free of diabetes and other lifestyle diseases. But the reality is we've turned the pyramid upside down. We eat a lot of junk foods. Today is Sunday, so I know most people consider it a cheat day, so you've eaten a lot of junk. We eat a lot of meat unless the month does not allow, the pocket does not allow. That's when people slow down a bit in eating meat. Meat is not good for you. It produces a lot of uric acid and cholesterol. It also takes you to a risk of actually getting high blood pressure and even diabetes. So reduce the amount of meat that you're actually eating. Then fruits and vegetables, we are not eating enough of this. In fact, we say that they are for children. and sick people. So we've turned the pyramid upside down. And when you do that, then you find that you're heading into problems. And that's where lifestyle diseases start. So there's a gentleman there called Jerry Brasfield, and Jerry Brasfield is the founder of Neolife International. He put together what we call the Scientific Advisory Board, which is a board of scientists that does the research on the products. They ensure that the products are safe, they don't have a side effect. They are led by Dr. Arthur First, who was the #1 toxicologist in the world. And he's the man who invented an antidote for chemo, for oral chemotherapy, in one of our products called Betagard. But then he said, why can't he come up with fellow scientists and do some research and produce supplements that can actually help to reverse some of these lifestyle diseases like diabetes, pressure, and the like. And that's what they did, and they partnered with Neolife. Neolife produces the products from a natural and whole food perspective. In fact, their principle is based in nature and backed by science. Now, the products of Neolife work. That's one thing I can tell you. They work, they do what they promise. In fact, the company is so confident that they give you a money-back guarantee. If you use their products and they don't do what they're supposed to do, you can return them either for a replacement or you can get a refund out of it. I've been in Neolife for more than 20 years. I've never seen anybody take back the products that they didn't work. So actually they overwork. They give better results than one's expectations. When I talk to most of my clients and my distributors, Neolife products help them to sort out issues that in some cases, they never even thought that they had. Yeah. So to turn the pyramid the right way up, we have a product we call ProVitality. It has TRNN, which is a whole food supplement. It's made from the grains. This TRNN has lipids and sterols, which are fatty acids from wheat, rice, and soya. Then we have omega-3 salmon made from pure fish from the Arctic, where there's no pollution. Then we have carotenoid complex. Now, carotenoid complex has 18 different types of fresh fruits and vegetables in it. So when you're talking about fresh fruits and vegetables, there you have it. Then we have a mineral supplement, which has a whole spectrum of minerals, including folic acid, B12, B6, and the like. So these are when you combine these products, you form the ProVitality Plus. And when you go back to the pyramid, this product turns your pyramid from being upside down, like the one on the left, to being upright, like the one on my right. So that's the first product that you need to help you fight diabetes and to help you prevent yourself from diabetes, ProVitality Plus. The second product is called fiber tablets. Now, fiber tablets has both soluble and insoluble fiber. Now, it helps to reduce the speed at which refined carbohydrates are absorbed into the bloodstream as sugar. This regulates the function of the pancreas. It contributes a pleasant feeling of fullness and helps to regulate intestinal function. This is an amazing product. It actually saves 80% of sugar from blood. So if you get fiber tablets, if you want to get off insulin as fast and as soon as possible, then you need to get yourself on fiber tablets. Then you have another product called CoQ10. CoQ10. What does CoQ10 do? It helps improve heart health and blood sugar regulation, assists in the prevention and treatment of cancer, and it reduces the frequency of migraines. Now, this is an amazing, amazing product, CoQ10. Now, CoQ10 gets into the mitochondria of the cell. It helps to sort of fire up the cell from inside. Now, we are made up of cells. Your pancreas is made up of cells. So when you take CoQ10, it actually helps your internal organs to function properly. So it kickstarts your pancreas, and your pancreas starts producing insulin again. And if it had a problem, then that one is sorted out. It is good for your heart, your brain, your reproductive organs. All the organs in your body will be smiling when you start taking some CoQ10. Remember, we are saying don't wait until you're sick. start when you're still healthy so that you avoid getting the disease. But if you already have the disease, then these products will also help you in reversing that disease so that it doesn't kill you. Then we have another exciting product. It's called chelated zinc. Chelated zinc, insulin, the insulin that we normally inject ourselves is over 80% zinc. It's made from zinc, 80% of it. The only problem is that insulin builds dependency because it's not made from natural sources. But when you have a chelated zinc, it's actually made from the fruits and vegetables that you normally eat. And when you take it, you find that you get the valuable zinc into your system. Now, what will zinc do for you? It actually controls prostate gland function, deals with ulcers, wounds, acne, relieves colds, sickness, fever, flu, viruses, and it's also good for diabetes protection. So you need to get some zinc into your Lydia, we had already done that one. You can move on to the next one. I think it was botanical balance. So we're talking about botanical balance. Botanical balance actually balances out your sugar levels in your body so that you can be able to, it balances it out. And it's very interesting what it is made of. If you look at the screen, you can see the constituents of botanical balance. It's turmeric, curcumin, and cinnamon. These are herbs that are freely available. You can get them in the supermarket and you can actually start using them immediately and they'll help you to manage your sugar levels. And you can see what happens with the curcumin. It manages glucose uptake. Then the cinnamon optimizes insulin uptake. And the turmeric actually maximizes insulin receptor function. So get some of this, quickly dash to the supermarket. And even as you're planning to buy the products of Neolife, start using these herbs in your diet. They're extremely important. Then we have for weight management. Remember we said that if you're obese, you run a risk of becoming diabetic. So it's important for you to manage your weight. And how can you do that? We have our weight management program with the Neolife Shake and the Neolife Tea. This will help you to burn excess fat in your body. And that will help you to prevent yourself from getting diabetes. The Neolife Shake also has fiber in it. So the fiber helps in saving the sugar from blood. We have talked about it earlier. So moving on to the next screen. But one thing I must say is that with the Neolife Tea is that it really helped me to burn, especially the midsection. If you want to burn your pot, because many people are always concerned about their pot. And one thing that my sister shared with me is that the size of your belly determines how far or how close you are to getting diabetes and high blood pressure. Because if you have a big belly, then you have a lot of visceral fat, which means that the fat is lying on vital internal organs, and that can lead to either diabetes or high blood pressure or both. So it's important to control the size of your belly. Start doing some cardio, some exercises, so that you can be able to burn this part of this fat that is lying on your bed. So take care of your body. It's the only place you have to live in. We don't have any other life. This is it, guys. So let's take care of our bodies so that we can be able to live a longer, healthier life. Because if you don't take care of that body, then you have to spend all your money running from hospital to hospital, trying to manage the diseases that you're going to get. Now, yesterday I was with one of my very new distributors who joined us the other day. And this lady was just giving her testimony. She had serious diabetes. It was always too high. It was unmanageable. And when it would go down, it would go down so low that it was life-threatening. And she used our products. She's only used our products for about a month. And the doctor confirmed that the sugar levels are now at 6. They have settled at 6, and they've been at 6 for more than, I think she's been on 6 for more than 3 weeks. Before that, she had always had high sugar levels at any one time. And that tells you that the products work. And guys, diabetes is becoming a very serious disease. I met a lady yesterday. She's only 22, but she has diabetes. And she's about to start using our products. But you don't want to be in that category. And that is why we say, don't wait until you fall sick. Start using the products when you're still healthy so that you can avoid getting the disease. Now, Neolife has other interventions, not just diabetes. We have bone and joint health, stress management solutions, sharper mind, healthy heart, energy and fitness, digestive health, balancing sugar levels, men and women, fertility issues, low libido, hormonal imbalance, PMS, menopausal challenges. And we also have children's health. And it's also important to mention that we have a product for farming called Supergrow that helps to double production in the farm. So if you want to know, I know it is a planting season for many double your yield for this month, for this season. Make sure you talk to the person who invited you and ask him, can I get a product? Here there's a product that can double my production in the farm and reduce the amount of chemical fertilizers that I'm using. Then they're going to show you that particular product. It's called Supergrow, and it's just an amazing, amazing product. So guys, we are coming to the end of our session. And again, sorry for that interruption by the internet. But I want to say, guys, you have a choice. You can either buy these products from the person who invited you, ask him, how can I access these products? And you can become a customer and be buying at retail from that person. Alternatively, you can be able to join the business and become a distributor, like some of us, and start doing it as a business and start making money as well, or even just join to get the products at wholesale price. Whichever decision you make is most welcome to us. But it was a pleasure sharing with you. It was a pleasure talking to you guys. And I invite you tomorrow at 8 o'clock. We will be having a fantastic presentation by our leader from South Africa, Pascal Olo, and he'll be sharing on how you can be able to make money with these products of Neolife. So if you want to know more about the business side of things, how to make money, then join us tomorrow at 8 o'clock on the same link that you have. Just come in and listen on how can you be able to make money, how can you be able to travel the world. We've just come from Tanzania. It was so exciting. We are going to Mauritius next year. A few months ago, we were in Turkey. So if you want to become a globetrotter and an international traveler, then you are the right place at the right time with the right team of people. Talk to the person who invited you. Ask him, how can I be part of these global globetrotters? And we have an event that is happening, which is ending our year. On the 25th, we have an event at KICC. It's a convention, the Royal Convention. We welcome you as well to participate. It's the last event of the year. If you want to finish strong, you are welcome to attend and be part of us. So thank you, guys. Have a good evening. God bless you. And we'll see you again next Sunday when we will discuss a different aspect of health. And I'm so excited. Next Sunday, we have a fantastic speaker coming along, and she will be sharing a very powerful presentation on how you can live a longer, healthier life. Thank you all. God bless you. and have a blessed rest of the evening. And we'll see you tomorrow in the 8 o'clock at Pascal Olo's session. Thank you and bye.